Hello, Dr. Ijadi here. We got Jason, Western medical student, with us today. We're going to do the knee exam. What we like to do initially is start with inspection of the knee. So you could do it in a couple ways. Obviously, you could do it in a sitting position or standing position. Typically, I do this in a sitting position. You evaluate the knees for any swelling, any erythema, any abnormalities of where the kneecaps are placed, if they're moved or shift laterally. And then you could also look at the legs as well, looking for any edema or any abnormalities as well. You like to have to initially get the patient up and do a gait analysis. So if you don't mind just getting up and having him take 10 or more steps, just going straight, just evaluating his gait there. Come on back. You're looking for any valgus or varus deformities of the knee, any pronate, go ahead and have a seat, any pronation of the feet, if his feet are externally rotated. So that's a quick initial assessment of the knee. Then we'll go ahead and have him lay on down. Let me get this going here. So with the patient laying down here, I like to initially start with some range of motion of the knee here. So go ahead and flex in your knee. The normal range of motion of a knee is 0 to 140 degrees. So I like to assess both knees here, if you could bring that. And here you'll be able to have an understanding of if there's a difference, if someone has loss of range of motion with flexion and extension. Extension should be at 0, and in many cases they could have a hyperextension, which is normal, but no more than 10 degrees, okay? Then our next step will be palpation of the knee. In palpation here, initially I like to take a look at the patella, palpate the quadriceps tendon here above the patella. Then we could do a quick patella apprehension test where we're pushing the patella out and looking for any apprehension if he's feeling it unstable, as if it's going to pop out. Then would press here on the patella tendon, palpate that as it comes and attaches on that tibial tuberosity. Okay, then we'll go ahead and bring him into flexion at 90 degrees here, and you can continue palpation across the joint lines. Here on the lateral joint line, and I always recommend doing one joint line at a time, and here on the medial joint line, palpating. Now again, I would recommend palpating on that medial femoral condyle, palpating on the lateral femoral condyle and seeing if that causes pain. Also palpating the proximal fibula here on the side here, and palpating the pes anserine bursa to see if that is causing any pain as well. Okay, and then we could get into some of our specialty tests. For specialty tests and evaluations, if you don't mind, I'm going to have you swing on back over this way. First test that I tend to go for here is the Lockman. Jason, if you don't mind going up just a bit so that the heels are on. There you go, perfect. For the Lockman, you want to get the knee in about 20 to 30 degrees in flexion. You want to stabilize the femur, and you want to grab the tibia, kind of cross a little bit above the tibial tuberosity, and you're just going to pull towards your chest. And you're looking for laxity, and you're feeling that end point. Okay, if there's an end point, you have a good ACL. If you have laxity, then there would possibly be an ACL tear. When you're in this position, again, you could test the valgus test. This is the MCL, and you're stressing that MCL to see if there's any laxity there. For the lateral collateral ligament, you could do it a couple ways. I tend to just swing them on over, grab the femur here, and pull this way, and you're giving a varus test to the LCL. The other way is you could kind of bend it in the 20 degrees, and again, you're giving them a force here, and you're evaluating the lateral collateral ligament for any laxity. In addition to that, as you're palpating the posterior fossa here, looking for Baker's cyst or any tenderness on the hamstrings, you could get them into the anterior drawer test at 90 degrees. You're going to go ahead and sit on the foot, stabilizing the foot, and you're going to be pulling the tibia towards you. Again, you're looking for laxity, and then pushing down. That was the anterior drawer test. pushing down here and looking for laxity, increased laxity posterior. That's the posterior door test. The anterior door test tests the ACL. The posterior door test the PCL. Okay. Again, getting to the patella here, you could do the Boltzmann test when you're pressing down on the patella. Look if that causes pain. The patella grind test, where you push down on that patella tendon, ask him to squeeze his quadriceps, and that patella grinds on that femur. If that causes pain, that'd be consistent with patellofemoral syndrome. Okay, I think we did the major test. Another addition test, the McMurray. Okay, so for the McMurray, you want to get them about 90 degrees. You want to grab the joint line. You want to twist, and you're looking and feeling for a click, okay, and pain. For a positive McMurray, you're looking for a click and pain, and now you want to do it both ways, both medial and laterally. And in addition, you want to do this with the valgus as you extend them out, and then a varus as you extend them out. And again, you're looking for pain and a click for it to be positive. And then if you don't mind, just getting onto your belly. Additional tests for the meniscus is the aptly, and you're just kind of grinding the knee as you're bringing them into flexion and asking to see if they have any pain with that. That could be consistent with the meniscus tear as well. And the last test, if you don't mind, Jason, coming over to the counter, putting your hands on the counter, and you're going to stand on your left leg only. You're going to bend it about 20-30 degrees, and you swing your hips from side to side. And this is the Thessaly test, okay? And this is, again, another test that we use that are sensitive for picking up a meniscus injury. I think we went over the major ones, so thank you very much for watching. Appreciate it. Thanks, Jason.